Hi friends, good morning and welcome to my channel. Friends, in this video we can see the questions for exam. We will see the question one by one. The first question is from nutrition. We will see the question. First question, percentage of total energy intake made by carbohydrate in balanced diet is. Question and options are option A 7 to 15 percentage, option B 10 to 30 percentage, option C 60 to 70 percentage, and option D none of this. Here the question is percentage of total energy intake by carbohydrate. This is the question. So here correct answer is option C, 60 to 70 percentage is the correct answer in this question. The percentage of total energy intake made by carbohydrate is 60 to 70 percentage. We will see the energy, that is total energy intake in different food group. We can see in balanced diet 60 to 70 percentage of total energy intake should be made by carbohydrate in our balanced diet, and 10 to 30 percentage of total energy intake is made by fat. Okay, and 7 to 15 percentage of total energy intake is made by protein. Okay, in our balanced diet carbohydrate provides 60 to 70 percentage of total energy, and the fat gives 10 to 30 percentage of total energy, and protein gives 7 to 15 percentage of our total energy intake. Okay, here correct answer is option C, 60 to 70 percentage. The next question, second question, in following which is not an essential amino acid? Options are option A leucine, option B lysine, option C arginine, option D methionine. Here question is which one is not an essential amino acid? That is the question, and the correct answer is option C. Arginine is a non-essential amino acid. It is not an essential amino acid. We will see the essential and non-essential amino acid. Essential amino acid include leucine, isoleucine, histidine, lysine, methionine, phenylalanine, tryptophan, valine, threonine. These all included in essential amino acid, and non-essential amino acid include alanine, aspartic acid, glutamine, glutamic acid, arginine, asparagine, serine, cysteine, glycine, proline, and tyrosine. These are all non-essential amino acid. Here our question is which is not an essential amino acid. So essential amino acid all we saw, and non-essential amino acid we saw. Among this non-essential amino acid is arginine. Option C is correct answer. The next question, third question, at the time of birth, length of a baby is about option A 30 to 35 centimeter, option B 35 to 40 centimeter, option C 45 to 50 centimeter, option D 50 to 60 centimeter. Our question is the length of baby at the time of birth. That is the question, and correct answer is option C 45 to 50 centimeter. So here the length of a newborn at birth is about 45 to 50 centimeter. Okay, and the birth height, length or height, the height doubles at the age of 4 years. Okay, birth height doubles at 4 years, and birth height triples at the age of 13 to 15 years. So at birth 45 to 50 centimeter, and it doubles by 4 years, and it triples by 13 to 15 years. Our question is at the time of birth. So it is 45 to 50 centimeter. Option C is correct answer. Fourth question, most common symptom of opioid toxicity is. Options are option A constricted pupil, option B dilated pupil, option C high fever, option D dyspnea. Here question is one of the most common symptom of opioid poisoning is Option A, constricted pupil. If it is pinpoint pupil is there, that is also correct answer. So here constricted pupil is the correct answer. How it affect the pupil means, when a person is taking opioid or if it get a toxicity, it will affect the central nervous system, especially parasympathetic nerve system. Okay, so it will affect the parasympathetic nerve system, and there is a constriction of the pupil occurs to the person. And also in case of this opioid poisoning, there is decreased blood pressure. It is an important point. BP will be decreased, heart rate will be decreased, and also respiratory rate will be decreased, and temperature body slightly decreased. Body temperature also can noted in a person having opioid toxicity. And some example of this opioid include heroin or brown sugar, pethidine, and naloxone are some examples of this opioid. Here, the most common symptom of opioid toxicity is constricted pupil. Option A is correct answer. Fifth question, which of the following muscle is present in the anterior aspect of the thigh? And the options are: option A, rectus femoris; option B, hamstrings muscle; option C, deltoid muscle; option D, lateral rectus muscle. Here the question is, which muscle is present in the anterior aspect of the thigh? That is the question. So here correct answer is option A, rectus femoris is the correct answer. Rectus femoris is the muscle which is present in the anterior aspect of the thigh. We will see the other muscles which is present in the anterior aspect of the thigh include sartorius muscles, vastus lateralis, vastus medialis, and rectus femoris and pectus muscles. Okay, here sartorius is the longest muscles in the body, and vastus lateralis usually injections in children's we are giving injections and all vastus lateralis. So in our question, the muscle which is present in the anterior aspect of the thigh is rectus femoris, and the other muscles, deltoid muscle which is originate from the lateral aspect of the clavicle, and lateral rectus muscle is there. Lateral rectus muscle is one of the extraocular muscles of the eye which help for rotate the eye by outwards, and hamstrings muscles is there, which is the muscle which is present in the back of the thigh, that is which is the muscles which is present in the back of the thigh, and it is coming downward of the leg. So here correct answer option C, option A, rectus femoris. Next question, sixth question, tuberculosis is caused by, and the options are: option A, Mycobacterium leprae; option B, Mycobacterium tuberculosis; option C, Clostridium tetani; option D, Corynebacterium diphtheriae. Here question is tuberculosis or TB is caused by, that is the question, and the answer we all know, option B is the correct answer, that is Mycobacterium tuberculosis is the correct answer. So the causative organism of tuberculosis is Mycobacterium tuberculosis, and its incubation period of this tuberculosis is 3 to 6 weeks. Usually it is 3 to 6 weeks, and the mode of transmission is droplet infection, droplet nuclei, and by infected articles. Okay, here question is tuberculosis is caused by Mycobacterium tuberculosis, and options: Mycobacterium leprae which cause leprosy, and the incubation period of this Mycobacterium leprae is 3 to 5 years. Okay, and the next option, Clostridium tetani, which cause tetanus. Another one option, Corynebacterium diphtheriae is there, Corynebacterium diphtheriae which cause diphtheria. Here tuberculosis. Another important point regarding this tuberculosis is barometer of social welfare is TB, and also white plague is also known as TB. This is the important point regarding TB. Barometer of social welfare is TB, and white plague is also known as TB. Okay, we will see the next question. Seventh question, accumulation of lymphatic fluid in the pleural space is known as. Options are: option A, pneumothorax; option B, hemothorax; Option C, chylothorax. Option D, hydrothorax. Here question is accumulation of lymphatic fluid in the pleural space. Correct answer will come. Option C, chylothorax is the correct answer. We will see the options. First one, pneumothorax. Pneumothorax means it's accumulation of air in the pleural space. So accumulation of air is known as pneumothorax, and accumulation of blood in the pleural space is known as hemothorax, and accumulation of water in the pleural space is known as hydrothorax. Here accumulation of lymphatic fluid in the pleural space is known as chylothorax. So here option C, chylothorax is the correct answer. That is the accumulation of lymphatic fluid in the pleural space. Eighth question, which is the most common and ideal pelvis? Options are android pelvis, option B gynecoid pelvis, option C platypod pelvis, option D anthropoid pelvis. Anthropoid pelvis. Here most common and ideal pelvis is option B gynecoid pelvis is the correct answer. The most favorable pelvis for childbirth is gynecoid pelvis. The most favorable pelvis for childbirth is gynecoid pelvis. There are four types of pelvis. First one is gynecoid pelvis. About 50% is gynecoid pelvis, and two anthropoid pelvis, anthroid pelvis, and platypoid or flat pelvis. There are four types of pelvis. Among this, gynecoid pelvis is the most favorable pelvis for childbirth. In our question, option B, gynecoid pelvis is the correct answer. And we will see the next question, ninth question. Ninth question, Hiroshima Day is celebrated on. Options are option A, August 6th, option B, August 9, option C, April 7, option D, April 17. Here question is, when is the Hiroshima Day? So here Hiroshima Day is celebrated on August 6th is the Hiroshima Day. Okay, and August 9 option is there, that is Nagasaki Day. Hiroshima Day and Nagasaki Day, that is important days. That is August 6 is Hiroshima Day, August 9 is Nagasaki Day, and April 7 is World Health Day, and April 17 is Hemophilia Day. Okay, April 7 World Health Day, April 17 is Hemophilia Day. 10th question, which of the following drug is used in the treatment of leprosy? Options are option A, dapsone, option B, clofazimine, option C, rifampicin, and option D, all of this. Your question is, which of the following drug is used in the treatment of leprosy? Here correct answer will come, and option D, all of this is the correct answer. This is one of the multi-drug treatment therapy for leprosy, that is dapsone, clofazimine, and rifampicin. These three are combination drug which is given for the treatment of leprosy. That is dapsone have leprostatic action, and clofazimine have leprostatic and anti-inflammatory action, and rifampicin which is bactericidal and most effective drug. So these three drugs are together give for the treatment of leprosy. That is multi-drug therapy for the treatment of leprosy is dapsone, clofazimine, and rifampicin. So option D, all of this is correct answer.